Coronavirus infections and hospitalizations are rising in the U.S., but the head of the CDC says deaths are going down. Total cases in the country have topped 31 million. More than 560,000 lives have been lost. The spread of variants are adding urgency to nationwide vaccination efforts. 68 million people have been fully vaccinated. That's more than 20% of the U.S. population. But vaccine maker Johnson & Johnson is facing some setbacks. A small percentage of people are reporting adverse reactions, and some vaccine sites have paused use of that vaccine. Nikki Battiste has the details.
Johnson & Johnson's vaccine facing a double dose of problems. Georgia, the third state to temporarily shut down a site after 8 suffered adverse reactions to the J&J vaccine. In North Carolina, 18 people reporting side effects. In Colorado, 11 reacting to the shot with symptoms ranging from dizziness, nausea, and fainting.
This is, a really potent vaccine. And what we're seeing is some of those potency relating in a very rare side effect that we just have to be aware of.
In fact, all 3 major U.S. vaccines produced adverse reactions in more than 60,000 people nationwide, except that for each manufacturer, including J&J, just 0.1% of all people have reported side effects. Another problem, distribution. The company dramatically scaling back shipments next week. In Michigan, dreadful deja vu. Some hospital ICUs once again nearing capacity.
Lives depend on it. Michigan is unquestionably a national hotspot right now.
The state's governor asking for a 2-week pause on indoor dining, in-person learning, and youth sports, a driving factor in new cases among kids. Pfizer is now the first company to seek emergency use authorization to give its vaccine to children as young as 12. Confusion in California. Those running one site with extra doses telling people to show up. Thousands did. Most turned away. In New York City, variants making up nearly 80% of new daily cases. Almost half are homegrown. Another 30% driven by the UK variant, which is believed to be up to 70% more contagious and more lethal.
Given the UK variant really dominating in the US, how effective still are the vaccines?
The current vaccines that are out there in the public work against all of the variants. The American public should rest assured that science is pivoting along with our knowledge to be able to take care of this. And the benefits of the vaccine tremendously outweigh any potential downside.
Here at Lenox Health Greenwich Village, about 1,300 people a day are receiving a dose of Pfizer. Dr. Eggis told me side effects from any vaccine are normal and people should not panic. Lana?
Good information. Thank you, Nikki. For more, let's bring in Dr. Teresa Amato. She is the Director of Emergency Medicine at Long Island Jewish Forest Hills. Dr. Amato, great to have you. Thank you for all that you do. We heard in that last package from Nikki's reporting, Dr. Eggis say he thinks that we're going to overcome this virus by June. Currently, roughly 20% of the population is fully vaccinated. So do you believe that overcoming COVID in 2 months is something that's possible?
Well, when you think about where we were just a few months back, the first vaccines coming here to the U.S. in late December, early January. And if you think about those first few days when we were just vaccinating, in the hundreds or thousands per day, and we're now seeing that 1 in 5 Americans are fully vaccinated against the COVID virus. That is a tremendous feat. And this is what happens when America comes together and gets on the same page. The amount of work, logistics, transportation, training that's had to go into this this operation has been tremendous. So what I'm really seeing is people really coming together, working really hard together to get this vaccine into arms, and it's really happening. And so there is a good chance that by the summer, we're going to see enough people vaccinated and have immunity that we will reach that we've been hoping for, is the herd immunity that will really get us back to life as we've known it.
We are all looking forward to that. Coronavirus infections, though, and hospitalizations are still climbing here in the U.S., even as deaths are falling. Explain to us again why we're seeing this, and does that mean that we need to be less concerned about people becoming infected with COVID-19 now?
Yeah, so what we learned from the first surge and the most recent surge, what you see is when you start to have another surge, if you will, you start to see slowly an increased number, then a rapid increase of number of positive cases. And unfortunately, the people that are going to succumb to those infections don't do it in the first few days or even maybe in the first week. What we have seen is COVID can be quite brutal, and really when people succumb to it, unfortunately, it's usually several days, weeks, or even a month later. We've saw people in the ICU for weeks on end, and then unfortunately just didn't make it. So it's not surprising when an increase of number of positive tests, and you see a little lag, and unfortunately a lag in the number of deaths. I wouldn't make that a comfort. I would say this makes me anxious that we may see another bump in unfortunately, in the number of deaths from the coronavirus.
I want to give you an opportunity to set the record straight because, as you've heard, vaccination sites in at least 4 states have reported adverse reactions to the Johnson & Johnson vaccine. Last time we were talking about adverse reactions, I remember you cautioning people not to be concerned about that as opposed to death and serious complications from COVID. In this case, the side effects were symptoms like dizziness, lightheadedness, rapid breathing, and sweating. Talk to us about how you respond to the news of these side effects.
So anytime you give someone a vaccine, you give a needle in their arm, draw their blood, there's always a chance that, and it's a very emotional time, people are excited but also nervous about the vaccine. And what we call this sometimes is what we call a vasovagal response to sort of something that's a little disturbing, like seeing a needle in your arm or having blood work done. There's a nerve that runs down into your chest. It's called your vagus nerve. It can be triggered by feeling very anxious, holding your breath, getting nervous, and it absolutely will drop your blood pressure. It will absolutely lower your heart rate. It will make you feel very dizzy, very lightheaded, like you're about to faint. This happens very frequently when we are doing any kind of intervention with patients, and we just lay people down, we talk them through it, and they seem to do very well after a few minutes. So from here, I wasn't there for some of these adverse reactions, but this is something very common that we see not infrequently in the emergency department in outpatient settings. That being said, we know that the vaccine can have side effects. There is no medication, there is no vaccine on this planet that doesn't have some side effects. The most common being having muscle aches, low-grade fever, a headache, feeling a little bit tired. We call it lethargy. I myself had those symptoms after the second vaccine, so very, very common. But when you look at the adverse reactions, they are still way less than 1%. And so when you look at the risk and benefits, I'm still going to say that the risk of getting COVID and getting pretty sick from it is pretty high. And the chance of having an adverse reaction to the vaccine is very, very low. So I still would say that the benefit far outweighs the risk. And I believe most medical experts are still saying that. We are expecting the more and more vaccines we give, we're going to see more adverse reactions because we're giving millions of them a day now. So when you put that in perspective, millions of shots a day and a handful of people not feeling well and then recovering perfectly fine after, I still would definitely say there is really no reason not to get the vaccine.
So your advice to anybody who's on the fence or was scheduled to get the vaccine who might be thinking twice is absolutely still go forward.
I would. And I say, anytime you have a concern, please speak to your physician, your doctor, and talk about your concerns, because feeling concerned is valid, but you should talk it through so that you feel comfortable when you do get the vaccine.
All right. Dr. Teresa Amato, thank you.
Thank you. Take care.